suddenly and very rapidly realised that the amount of projection you get with their filler was like nothing else I'd seen. It was like basically kind of injected the usual kind of bolus of filler that I would inject. That same volume has given me 20-30% more projection than I would have expected it to. It seems to be invisible to your immune system, which is kind of really handy from our point of view. We're putting fillers into patients that we now know hang around for 5, 10, 15 years. So if you've got something that your immune system can't see and essentially completely ignores, that seems like a nice feature. It seems to make the products thermodynamically stable. It does have a high extrusion force. There's no getting around that, and that I think is part and parcel of the technology that's in there. It is a stiffer filler to inject. If anything, it kind of slows you down a little bit, and I think these days we're all in a bit of a rush to kind of get these things done, and slower injecting is safe injecting.
Welcome to Inside Aesthetics, the world's leading podcast for cosmetic practitioners and business owners.
Our podcasts are aimed at medical professionals and should not be used to make medical, legal, or financial decisions. You should get an appropriately tailored piece of advice from a professional in your country.
To show your support and stay up to date with our latest episodes, click the follow button if you're listening on Apple Podcasts or Spotify, and if you're watching our episodes on YouTube, hit the subscribe button as well as the bell icon.
If you're interested in joining our online community, being a guest on the podcast, or would like to work with us, all of our contact details are in the show notes. And now, let's jump into today's episode. Jake, it's a momentous occasion.
It's a special day for several reasons. One, because we've got a real person in our studio for the first time in, I can't remember the last time we did this.
Well, we got a taste for it when we were up at the Fresh Life conference, where we had a little makeshift studio built for us. And then on our recent travels to Egypt and Canada, we had studios there as well. And then it was back here in virtual again, which is, it's a requirement because a lot of our guests don't live in Australia and can't just stop by my house for a chat. So, but it's interesting. It's nice. It feels old school.
Yeah. And we've got our good friend, Dr. Stephen Land, all the way from the UK. You must be jet lagged to hell, mate. How are you feeling?
Not too bad, actually. It's been a kind of multi-stop journey to get here via Dubai and Bali. So each step's been a couple of hours. So it's not too bad.
And no Bali belly for you?
No, I survived, which is good.
Awesome. So today is one of our Masterclass series, and we're going to focus on a new brand of filler, at least here in Australia, called Neauvia. Well, that's the company as well as the name of the filler. So, Stephen, first of all, tell our guests who you are, because you've been on the podcast before. It was episode 278, if you don't remember. It's not burnt into your brain.
Good memory.
Yeah. So, who are you? What do you do? And what's your background?
So, I'm Steve Land. I'm an aesthetic physician from the UK, based up in the grim north in Newcastle. I've been doing this for about 12 and a half years now, and teaching and training for various companies for the last 3 or 4 years.
Cool.
Right. And what did your medical history look like before aesthetics?
So prior to aesthetics, I was in emergency medicine. So I always describe my career as martial arts. So the A&E was all martial and the Spit's all art.
Yeah, right. There you go.
Fair enough. So if you guys haven't listened to our Masterclass series of episodes before, we talk about products. We usually talk about single products, but today we're going to talk about a range of products. Our previous one that we focused on, the chroma fillers, was quite well received. So we thought, well, let's just explore another brand.
Yeah. I mean, this is good for me because there's so many new products coming onto the market all the time. And in Australia, for so many years, there was just 2 players, 3 players. And it seems like in the last 18 months, 2 years, we've had just an explosion of different products, new fillers, new toxins, biostims, remodelers, boosters. Yeah. So these are good for me too, because I'm trying to stay up with it and get my head around it as well. So I'll be learning from this one as much as anyone else.
Awesome. And by the way, if you forgot, we are also visible now on Spotify and YouTube. So you can see me with my old school mic here, because we had to get our old mics out.
We've had to retrofit
to get Stephen in. So Stephen, I guess the obvious first question is, how long have you been using Neauvia fillers, and what were you previously using?
So I've been using the fillers for about 3.5 years, pretty much from when they kind of appeared in the UK. They had a new importer who kind of got in touch and said, I've got this new product that you might be interested in. There's some science behind it. And he knew I was a bit of a kind of science nerd. So he said, I've got a whole ton of papers about this new filler as to why you might like it. So sent me all the papers, which I had to read through, and it sounded interesting. So I said, it sounds interesting. So proof of the pudding is obviously in the eating. So come to clinic, bring a load with you, we'll give it a try and see what it's like. And I was blown away by the results and kind of pretty much changed overnight. From previously, I've been using Juvederm, Tioxane. I'd tried as you do over the years, I've tried most of the other kind of major brands to see what kind of fit with my practice. But mostly kind of Juvia and Tioxane were my go-to.
Okay. And, for the people who've never heard of this company, who are they? Where are they based? Where do they come from? What do they do?
So they're a kind of Swiss-Italian company. They're about 13 years old, so they've been going a kind of fair amount of time. And in kind of continental Europe, they're a big player. If you go to kind of the big IMCAS, AMWC conferences, their stand is as big and usually next to the kind of Allergan stand and the Tioxane stand and kind of big and glitzy. In the UK, they'd not really kind of made it into the UK until kind of 3 or 4 years ago. And then over the last kind of that same sort of 3 to 4 year time period, they've started to expand kind of worldwide as well. So they're now fairly big in kind of Southeast Asia. They've obviously just launched in Australia in the last kind of 6 months. They've just had their filler launch in Brazil 2 months ago. So they're kind of expanding rapidly. They're now in 80 odd countries around the world. So.
Yeah. Okay. And like the company itself, like, how would you describe their philosophy? What is it about them that you think makes them different or sets them apart from all the other players?
Okay, I mean, if you want the corporate answer to that, it's in the name. If you look at the name Neauvia, it means a new way.
Right.
So they kind of did that with their branding, and their idea is to do things in a kind of different way. So what they wanted to do is not only be a filler manufacturer or a device manufacturer or a kind of cosmeceuticals manufacturer. Their philosophy was, if we make the whole ecosystem, we can control how it all works together. So we can have a filler that's designed to be used in combination with our devices. We can have skincare that feeds the skin the appropriate ingredients that are going to boost the results you get from your energy-based devices, etc. So it's all kind of, the idea is to have this kind of all-encompassing ecosystem that's designed for combination.
Yeah, that's challenging, isn't it? I mean, you're talking about devices, skin treatments, fillers. I mean, some of the experience that I've had with some companies is that they often struggle to pivot between different modalities. Like they're geared up to be an HA manufacturer or distributor, and they try their hand at something else, and it's a completely different sort of kettle of fish. So yeah, it's an interesting concept.
Yeah, I think it is difficult to pull off. And I think when companies who are experts in one thing suddenly decide they're going to pivot into something else, that can be tricky.
Yeah.
Neauvia kind of started that from the outset. So they've always had kind of 3 different streams of devices, skincare and injectables. Yeah. So I think probably if you start off with that idea, it's potentially slightly easier. I don't know.
Yeah, probably right.
Yeah. So give us a flavour of what your practice looks like in Newcastle. What sort of stuff you're doing regularly? What were your favourite treatments? How do you approach your face? Just so we get context of how you use these fillers.
Yeah. So, I mean, my focus in clinic is on the injectables. So kind of mostly fillers, skin boosters, toxins are kind of my focus, because as I say, my background's in emergency medicine, so I want stuff that works immediately.
You've got polynucleotides.
Yeah, polynucleotides. Yeah, so I want stuff that works immediately. So kind of fillers have always been my kind of fave treatment to do. We've got 2 other injectors as well in clinic, and we've got a skin therapist who does all of our devices and skin peels and needling and kind of looks after skincare and all that sort of stuff. So the injectors kind of do all the injectables, and then I hand all my devices over to my therapist. But we kind of come up with joint plans between us. So there's a kind of, an overall kind of treatment plan as to where we're going. It's just that I like doing the injectables and she loves doing the energy-based devices. My other 2 injectors do a little bit of everything because they like doing a bit of everything. So it's allowed us to do what we like.
Yeah. You mentioned that the company contacted you. They wanted to show you the product.
Yep.
In fairness, every company says that their product's the best. It's got something different about it. And potentially, there are USPs for every new product on the market. But you said it instantly became obvious to you that this is the filler that you wanted to use and implement into your clinic. So what was that? Like, because HA fillers are HA fillers, right? I mean, what is it that was so different?
Yeah, I mean, I think the first important question for anyone to ask when they're approached by a new company about, this product, this filler, this device we've got is the best thing since sliced bread. And it's the same thing I always do when they do that, is to go, right, what's your evidence for that?
Yeah.
Send me the studies that show me that your device does what you say it does, that your filler is safe like you say it is, or does this, that, and the other. So that was my first question, as it always is. Send me the evidence. So they were quite happy to send me a whole load of studies they'd done looking at their filler safety and longevity and all the other things that we as injectors are kind of interested in. So any company that can do that to start off with always gets a little tick, because there's plenty out there that can't or don't. So then I said, okay, the evidence looks good, but as I say, it's no good having a filler that's perfectly safe and biodegradable and this, that, and the other if the results are rubbish. So they brought a load up to clinic, and the country manager at the time kind of just said, right, these are the fillers, these are the ones that we've got. Kind of inject them as you normally would. So, okay, fine. Cracked on with injecting, and suddenly and very rapidly realised that the amount of projection you get with their filler was like nothing else I'd seen. It was like basically kind of injected the usual kind of bolus of filler that I would inject on a patient, and then kind of stood back and went, shit, I'm just going to give that a little massage just to kind of smooth that down, because that same volume has given me 20-30% more projection than I would have expected it to. So it's like, okay, this is interesting. This has got something about it. So it was the fact that the results matched up with the kind of evidence they had for its kind of safety and longevity.
Okay. So for those not familiar with the Neauvia range, one of the key selling points that we're sort of dancing around is this different technology in the filler. So I don't know if you want to explain to our listeners who may be more junior what normal cross-linking is and what the normal sort of stuff that they put in traditional fillers, and then what's different with the Neauvia fillers.
Yeah, so the difference with the Neauvia fillers, as you say, is the cross-linking technology, which seems to infer some kind of really interesting properties on the filler. So the vast majority of fillers, when you buy them, your 1 ml syringe of filler is 96 to 97% water. So it's the most expensive syringe full of water you will ever buy. There's about 2% is actually hyaluronic acid, and then there's about 0.5%. There's a tiny kind of percentage of it is the cross-linking agent that holds the HA together and gives it its structure. And Neauvia, as I say, they wanted to look at a new way of doing things. So they kind of looked at what was out there, and 99% of fillers on the market are cross-linked with BDDE. And they thought, is there anything that's better? We'll look into it. So they kind of looked at lots of different things. And they came across polyethylene glycol, or PEG, which has been used as a polymerizing agent in the pharmaceutical space for the last 60, 70 years. So they're like, okay, we know it's safe. They've been using it for 70 years. Let's see what it does if we polymerize our HA with it. So they made some kind of PEG cross-linked filler, and it works like a normal filler does, but also has some other kind of interesting kind of features. So it seems to be invisible to your immune system, which is kind of really handy from our point of view. We're putting fillers into patients that we now know hang around for 5, 10, 15 years. So if we've got something that your immune system can't see and essentially completely ignores, that seems like a nice feature. It seems to make the products thermodynamically stable, which basically means you can heat them to a ridiculous temperature and it does nothing to the filler, which if they're looking at also creating devices, energy-based devices, most of which, heat your skin to 50, 60 degrees, if they've got a filler that's more heat stable, that's good for their idea of combining these treatments together. So they were kind of really interested in this PEG technology, and that's now what they use across their whole range of fillers.
Right. You mentioned BDDE. Now that's a terminology that's come under a little bit of speculation around potentially having an inflammatory effect on the body, and is that a good thing or a bad thing? What's your position on BDDE?
So, I mean, one of the reasons I changed over to this filler is because it has no BDDE in it. There is some slim, limited evidence that in large doses it's pro-inflammatory.
Right.
Sticking something pro-inflammatory into your skin and leaving it there for 10 years doesn't sound like a desperately sensible idea to me. I mean, the evidence is not spectacular, and the doses that they're talking about are much higher than those that are found in filler. But at the same time, if we know it's inflammatory and we've got an alternative that seems to be almost anti-inflammatory, then why would I not give that a try? Do you know what I mean?
Yeah.
So it's not that I think BDDE filler is the work of the devil. It's just that looking at the evidence, I thought that seems like a more sensible option to me.
What's your position, Jake, on BDDE?
Well, we were talking about this in our Patreon chat just in the last couple of days. So the conversation started from one of our injectors in the group who has a patient who has what seems like what we call a delayed onset swelling, or a transient lump a month or two after some filler, which, like you said, is super rare, but we know it happens enough to have this concept of, is it the BDDE? Is it the brand of filler? Is it the technique? Is it because they had a dental problem? Or is it all of these things? We don't know. So I guess, if you look at most of the fillers, the way they make them is they put a whole bunch of raw hyaluronic acid in a big vat. They put in water. They basically stir it all up, and then they pour in some free BDE. And then that reacts with the hyaluronic acid, like you said. So
heat up a bit, give it a stir.
Yeah, and then they put it through like a dialysis procedure. So all of the unbound, unlinked stuff gets filtered out, and what you're left with is basically cross-linked filler. So the amount of free BDD in there it's not zero, but it's very, 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 very low.
Yeah.
And the levels that, are sort of safe or deemed safe by the FDA and whoever have not been proven to be carcinogenic or anything else. So I don't know is the answer.
Yeah.
But it seems incredibly rare, or let's just say that 99.9% of our patients don't get these problems, regardless of the filler type.
Yeah.
So to blame it on anything, whether it's BDD or the brand of filler, also doesn't seem to make sense. But there's something going on.
Yeah. It's always difficult, isn't it, when you've got so many confounding factors that can sort of, how do you kind of analyze exactly what is causing that? Yeah.
Although the interesting point about Neuvia's HA fillers is that in the 13 years the company's been going, they've not had a single case of delayed onset nodules reported to them.
That's the key.
Yeah, I'm one of their KOLs. I'm going to stand here and say it's the best thing since sliced bread because, that's what
that's why you're here in Australia
occasionally. But I will always qualify that. And even when I'm standing on stage and I can see the people from Neauvia with their head in their hands going, he's going to say it again, isn't he? They employed me because I speak honestly, so they can't always get upset when I do it. But I will say we've not had a single case reported. Now, that doesn't mean it's not happened. It just means no one's reported it to the company.
Yeah.
I had a case of delayed onset nodules with a previous filler brand that I used. Did I report it to the company? No, I just fixed it because I was an experienced injector. I knew how to treat it. I got on and treated it and it sorted itself out.
Yeah.
If it hadn't sorted itself out and I'd had problems and I couldn't fix it, yes, I maybe would have kind of, put my hand up and shouted for help.
Yeah.
So do whichever company that is know that case of delayed onset nodules ever happened? No, they don't.
Yeah.
It's a good point because, I've done both things. I've neither reported and I have reported, and it's very painful to report. There's a lot of paperwork, bureaucracy and emails back and forth, and it's time consuming. And really, you just want to manage your patient.
Yeah. And if you're an experienced injector and it's delayed onset nodules, we know what the protocol is. We know what to do. So we just crack on and do it. And my thought was, if it doesn't get back when I've done all that, then I'll shout for help. But if it sorts itself out,
yeah, right.
and everyone's happy.
So what was your experience previously, or what have you heard from other injectors about this sort of delayed onset issue? Because that seems to be the unique selling point of what you're saying the Neauvia fillers can sort of avoid. But how big was the problem that it's solving?
Yeah, I mean, as you've rightly said, it's something that 99.9% of the time isn't a problem. But if I can make that 100 or 99.99% of the time, then it's worth a try, I think. Yeah, it's not a massive problem. It's not a massive issue. There do seem to be some brands where it's a little bit more common than other brands, and there seem to be some injectors who get it quite often and some that don't. So
interesting, right?
Yeah. So it's definitely kind of multifactorial. There was a Tom DeCat's kind of paper about it, so kind of blaming or kind of partially blaming bacterial kind of contamination. But I think if it was entirely bacterial contamination, then I'm not going to claim that Neauvia injectors are any cleaner than any other injector. Do you know what I mean? So I'm not entirely convinced bacterial contamination is the be all and end all. There's definitely several factors. We know that people with certain HLA subtypes are more prone to getting delayed onset nodules. So we know there's something in your immune system. There's probably something in the cleanliness of your injector. There's probably something in the filler brands themselves. Yeah. And I think it's a combination of all of those things that lead to a delayed onset nodule. So it's like that Swiss cheese model. Unless it all lines up, you're not going to have a problem.
Yeah. Something Jake and I was talking about a couple of days ago on the phone was delayed onset nodules, granulomas. I don't know what the difference is. Maybe this is a discussion for another day, but I mean, what is?
Well, basically, you're the expert, but delayed onset nodules are a clinical diagnosis. You just hear the story. Does it match the main symptoms of this thing, which is basically, once you've put a filler in the face, everyone can argue on the time scale, but at least 2 to 4 weeks after it was implanted, you suddenly get a problem out of nowhere or seemingly nowhere. And it can be warm, lumpy, hard, painful, all the signs of inflammation. And that's what I would classify as a delayed onset nodule. Do you agree?
Yeah, that pretty much sums it up.
So what's a granuloma?
Granuloma is a histological diagnosis. So you can only call it a granuloma if you biopsied it and looked at it under a microscope and gone, yes, that's a granuloma.
Right.
But I suspect there's kind of a spectrum, and at one end is a mostly infectious version, and at the other end is a mostly kind of inflammatory reactive version, and a lot of them are kind of somewhere between those two kind of ends. Because I think it's multifactorial. I think obviously if you're don't bother washing your hands and you kind of lick your patient to clean them, then yeah, you're going to get something down the infectious
I don't know what
end.
you guys do in Newcastle, Stephen, but it's not the way we do things here.
I don't think you want to know.
If you've got patients who've got those HLA subtypes and you've used one of the fillers that seems to be a little bit more prone to these things, it's probably going to be down the inflammatory end of things. But I suspect most are somewhere along that spectrum.
Yeah. By the way, if people really want to nerd out about this, we did 2 episodes with Tom DeCatz, who's like world expert on this stuff. Can't remember what episodes they were, but search them in our library.
It was a long time ago.
It was a little while ago.
His PhD thesis is available online and is a very interesting read if you're a massive nerd.
Yes.
Yeah.
So you kind of touched on, I'm going to call it pegylation. Is that a word?
Yes.
Pegylation being not just sort of good for sterility and reducing complication, but also affecting the performance of the filler.
Yeah.
So what is it doing? Like if you can relate it to, most people know about G prime or cohesivity or viscosity. Like how would you describe the rheology of the Neauvia fillers?
Yeah, it seems to do a couple of things kind of rheological wise. It seems to lead to an incredibly cohesive product. There's this little trick that all the kind of Neauvia KOLs like to do where we get their kind of thickest filler and you squidge it and slowly press it out of the syringe and you can get basically a kind of long thread of what looks like snot, essentially about kind of 4, 5, 6 inches long. And then because of how cohesive it is, you can actually just draw it back into the syringe. It's quite cool to watch.
Yeah.
That's the final test for being a Neauvia KOL. If you can do that, you can be a Neauvia KOL. So it does seem to have this kind of really, really high cohesivity. G prime wise, actually, if you measure it, it's got quite a low G prime. There's an interesting study done by Kotofana a few years back where he got lots of different brands, fed them all into the same rheometer just to kind of standardize the testing. And it was, there was Juvederm in there was Tioxane in there was Belafil in there, and rather helpfully there was Neauvia in there. And if you look at all their kind of 4 standard products, they were all way down the kind of soft end of rheology, which I think probably just goes to say that rheology is and G prime is nowhere near as important as we all pretend it is. Yeah. I always kind of make the joke on my when I'm training that G prime is fine, but you have to squash some filler between 2 metal plates and turn them back and forth and see what numbers you get out of it, which is great in the laboratory. But when you start putting it into patients and then trying to squash their head between 2 metal plates and turn it back and forth, they get all shirty about it. So G prime is a fantastic lab-based figure, but quite how that kind of reflects in what we see in reality when we inject these products into patients is unknown.
Yeah, that's a good point, actually. I think all the companies have got their own parameters and their own terminology. Yeah. It doesn't reflect on a real universal standard.
Yeah, I think if you look at it, when you're measuring G prime, the amount of filler you put some filler between 2 metal plates and squash it, and then you turn them a bit, and then you let go, and you see how much energy is returned by the filler returning to its original shape. That's G prime. But it depends how fast you turn those plates. It depends how much filler you put between the 2 metal plates. It depends on the device, and it depends how much squish you put on it in the first place. So it's probably easy to compare G prime within a study, but from study to study is probably difficult because the device manufacturer, the filler manufacturers rarely tell you which device, which parameters, which how much filler, et cetera, et cetera.
And then I guess it would respond differently in different tissue, in different planes.
Yeah.
Through different needles, through different cannulas.
Yeah, so, you change the rheology of filler by squishing it through different needles.
Yeah. So, and whether you do face yoga or Pilates or how hard your pillow is, it's all going to change every day.
So G prime is it's a vaguely useful figure. I think it allows you to compare within a filler brand, but probably brand to brand, and what happens when you put it in a patient is anyone's guess.
So you mentioned that the PEG technology theoretically reduces inflammation, which we kind of discussed as not really a massive issue, but we know that that there is some studies, there's some indications that the BDDE does cause some inflammation. But what else does the PEG technology do in terms of performance, longevity, how it reacts to the tissues? And you could have mentioned right at the beginning, you just saw this 20 to 30% increase in the amount of projection you were getting. So is that related to the PEG technology?
I can only assume so, and related to the cohesivity. It's certainly not related to the G prime because, as we've said, it's kind of way down the bottom end, and you would expect these fillers to be super soft. But when you put them in, as I say, their kind of thick product gives more lift than anything else I've seen in my life. The other interesting thing about PEG is it is itself a polymer, which means you can make different length PEG molecules, which means you could have a really long one that holds the molecules of HA miles apart, or you could have quite a short one that holds the molecules of HA quite close together.
Right.
So what Neauvia did was again looked at different kind of chain lengths for their polymer and kind of settled on a length that's a bit longer than BDDE, which just theoretically allows the filler to be a bit more flexible, which should mean it's a little bit more resistant to kind of biomechanical breakdown because it's got a bit more kind of flexibility and give. It also seems to infer some protection from enzymatic breakdown. because it seems to make your immune system, it seems to make the filler a bit more kind of invisible to your immune system, you seem to get less enzymatic breakdown. So if you combine kind of a bit more flexibility with a bit of resistance to hyaluronidase, then you do seem to have a filler that has an increased longevity. You might argue that having an increased resistance to hyaluronidase, I could see Jake's face kind of going, interesting. An increased resistance to hyaluronidase, is that a bad thing if things go wrong? There are studies that have been done by Neauvia that show that you need 20 to 30% more hyaluronidase to break down their filler compared to most kind of BDDE brands. So you could make that argument. I've dealt with, at last count, about 20-21 vascular occlusions.
All yours?
Oh yeah, all mine, obviously. No, one mine, and about 20 that have found their mystical way into my clinic. And do I count how many units of Hyalase I put into the patient, or do I just keep putting Hyalase into the problem until it goes away? It's definitely the latter. Am I bothered if it takes 1 vial or 2 vials or 3 vials or 5 vials or 11 vials, I think is the most I've ever had to use? No, I just keep throwing Hyalase at the problem until the patient's better.
Yeah.
So yes, I know I have to keep an extra vial or 2 in the fridge, but on a practical basis, it kind of makes no difference.
I think that's complete. Yeah, that makes total sense. Like, who cares whether you do 20, 50, 100, 1,000? It's irrelevant, really.
Yeah, you're treating to clinical effect. So
yeah, you touched on something interesting about the length of the PEG molecule versus the amount of PEG molecules per strand, let's say.
Yeah.
So which is it? Are they varying the length to change the range of filler, or the amount of cross-linking?
So to vary the kind of stiffness of the filler, they're actually varying the amount of HA that they're putting in. So the degree of cross-linking remains much the same. They picked their range of kind of PEG polymer lengths and kind of control that to a certain kind of window of size. So to vary the kind of stiffness of their fillers, it's the HA content that they're varying.
Okay. And then how does that affect extrusion force? That's something that we've discussed a couple of times because of, just intensity, tiredness, fatigue, risk of RSI, just comfort for the injector. How does that perform?
So it does have a high extrusion force. There's no getting around that. And that, I think, is part and parcel of the technology that's in there. It is a stiffer filler to inject than anything else that you'll use, to be honest. Okay. But when I first started, I kind of spent a day using Neauvia fillers, and then I spent a day using something a bit easier, and then I spent a day using Neauvia fillers until I developed a lot of grip strength in my right hand. And you can definitely tell if you've been...
You didn't already have that?
Not that much.
You use other hand, yeah.
Yeah. And you can definitely tell if you've been on holiday for a couple of weeks, you kind of come back and you're like, oh, Jesus, this stuff's a bit stiff. But, day to day, I'm kind of back up to kind of fairly normal injecting speed. And I think, if anything, it kind of slows you down a little bit. And I think these days we're all in a bit of a rush to kind of get these things done. And slower injecting is safe injecting. If the tip of my needle is in a blood vessel and I can only squeeze it out at a really, really slow rate, I'm going to notice a problem before I've accidentally slung 0.5 ml of filler into a vessel. Yeah. So slow injecting is safe injecting. Everyone just needs to chill.
I mean, I guess the point would be, obviously you're a male with much more grip strength than your typical female. So, female injectors might find that a little more difficult. And is there ways you can combat it by changing, the cannula thickness or anything like that?
The fillers at the kind of higher G prime end of the range do come with a 22 gauge cannula. And I have tried squeezing them down 25 gauge cannula, and it's not a very clever experience. But they come with a TSK cannula. So, you can't really complain too much. And the thinner end fillers, I'll be using a 27 gauge needle instead of a 30. So, there's ways around it to make it easier for you, but it is a stiff filler to inject. There's no getting around that.
I guess that kind of raises an interesting point, which is that injectors need to know that they're going to need to adapt their style and their technique for different products. And we see this not just with fillers, with toxins. Someone will move from one toxin to the other and they'll apply exactly the same injection technique, the same pattern, the same dilution. They're like, oh, this doesn't work. It's terrible for frontalis. And you're like, so I think it just raises the point that, get trained properly, trial it, get your technique, understand you do need to make adjustments. I mean, Jake, you sort of train people part-time for a living. Is this something that you talk about with your 100% students?
I mean, you've mentioned three things. 1, extrusion force. 2, the lift capacity. 3, need for more Hyalase if you need it. Like it's not bad or good. It's just different.
Yeah.
And if you don't know that and you treat it the same as your old filler, you're going to moan and say, well, it's not as good or it's different. Yeah. So,
and we see the same with, as you say, you see the same with toxins. They all have slightly different spread and diffusion. They all have slightly different nuances. And it's just picking the right instrument for the job.
Yeah.
So training just to make sure you know what's going on, speaking to people that have used it. But it's the same with any filler.
Yeah. Well, it's just like people need to just make sure that before game day, they've actually done enough practice. You know, it's like getting in a car that's not your daily driver and doing a race with it. Like you might want to spend a few weeks just driving around the streets, getting used to the turning circle and all that kind of stuff. It's the same with this stuff, right?
Yeah.
100%.
Hey guys, sorry for the quick interruption to your podcast, but David and I know that being an injector and a business owner can be a challenging and sometimes lonely journey.
And it's not always easy to know where to turn to for trusted advice and genuine support.
There's a lot of gatekeeping and negativity out there, and that can make it hard to upskill and also access reliable information.
We also understand how important it is to have a positive, supportive community around you. That's why 3 years ago, we launched our own private online education community.
Yeah, we wanted to create a safe, uplifting space where injectors and business owners can learn, connect and grow, both clinically and in business.
And since then, our community has grown to over 2,000 international members, from highly experienced practitioners all the way through to those that are just starting out in their careers.
So if that sounds like something you'd like to be part of, you can find out more and join by clicking the link in our show notes. Now let's get back into the podcast.
So walk us through the range of Neauvia fillers. Most people will have an appreciation for sort of thinner fillers to thickest fillers, and obviously this might vary in different countries depending on what's available. But broadly speaking, what does the range sort of look like in terms of names of filler? And then maybe you could relate that to areas of the face that you might typically treat it with.
Yeah. Well, I always say that Neauvia have the same 4 products that almost every filler manufacturer have. And I think when I rule the world, I'm going to rename them as thin, medium, thick, and really thick, because then everyone will know what they do. But all filler manufacturers seem to like to give them like silly names or like, I think Toxin were closest they came up with like 2, 3, 4, and then ultra deep, because they obviously forgot how to count to 5. So like, they almost got there, but not quite. So when I rule the world, thin, medium, thick, and stupidly thick, or whatever I decide I'm going to call the last one. And they have the same 4 fillers as everyone else. They have their thinnest filler, their kind of softest filler is called Intense Rheology. Their next one up is called Intense Lips, so you can imagine where that's designed for. The next one up is called Intense LV, and then their highest one is called Intense. And you would use them in the same sort of areas as you would use kind of the kind of fillers from other manufacturers. I always kind of compare to Juvederm, because that's the kind of, the biggest brand that most people know. So Rheology is kind of the equivalent of Volbella, and Lips is the equivalent of Volift, and LV is the equivalent of Voluma, and Intense is the equivalent of Volux. But then they also have some kind of what I refer to as the special products, which are kind of slightly off to one side because they're a little bit weird. So you've got the same 4 basic products as everyone else, but then
they're just HAs.
HA, PEG. They've got a little bit of glycine and proline in, so they put a few amino acids in there. That's partly because they act as antioxidants, partly because they're the building blocks of collagen. And we know that sticking filler into people stimulates some neocollagenesis. So they kind of thought, if we're going to do that, we may as well feed it a little bit. And I say they do act as antioxidants as well. So that's in all the fillers. And then I say they have these kind of 2 special products. They have one called Intense Flux, which has got the same amount of HA as kind of LV, their thick filler. So it should be a thick filler, but it's only got 50% of the cross-linking agent in. So when you're kind of messing about with it, it's like runny honey. It's just really weird stuff. And I don't think as a company, I think they made it and kind of went, oh, this stuff's weird. We'll release this. We've no idea what we're going to do with it, but it's interesting. And I don't think as injectors, we've quite fathomed all the uses for it. It's almost like a kind of lightly cross-linked skin booster. It's almost like a ever so slightly volumizing filler. It provides lots of hydration. It's just odd.
It's reminding me of Profilo Structura kind of thing.
Yeah, kind of. So it's weird stuff, but it's good for kind of all those kind of slightly oddball indications that you can never quite find the right product for. So smoker's lines, you can kind of just cannula a sheet into the kind of white lip. Lateral canthal lines, you can kind of cannula some into there. Necklace lines on necks, you can cannula some into there. So it's good for all of these kind of slightly tricky to treat areas where you just want something that's going to hydrate, give the tiniest bit of volume. So that's kind of special product number 1. And I love it just because I think it's just weird and we don't quite know what to do with it. And then they've got another kind of special product, which is Neauvia Stimulate, which again has the same amount of HA as kind of LV as their thick product. Same amount of cross-linking, but it also has 1% calcium hydroxyapatite in it, which is why it's called Stimulate, because the idea is that calcium kind of stimulates the fibroblast, so you get the structure from the HA aspect of it, but you also get that kind of biostimulation from the calcium aspect of it. So that's a really interesting product. I use gallons of that in my clinic because I think you get 2 treatments for the price of 1. So why would you not?
So with that one, obviously lots of people making their own home brew at the moment with competitor brands, and they're mixing them up at home. So how does that compare with your previous experience of maybe making your own kind of stuff?
Yeah, so I think compared to making your own, it's made in a factory, so it's all kind of nice and sterile. The quantities are exactly what it says on the tin, which is kind of a good place to start, I think, if we're sticking these things into patients. Is it a very small percentage of calcium? Yes. And people kind of make the argument that is it even worth having kind of 1% calcium and does it do anything? The studies we've got show that it does, and the patients I've got show that it definitely does. And it seems to be just the way it's kind of put together, because those calcium microspheres are kind of locked into the kind of PEG HA kind of polymer. It's almost like a slow release product. Instead of, something like a kind of pure calcium hydroxyapatite product, you put it in, as soon as that carrier molecule kind of breaks down, a lot of the calcium gets washed away. So you've got X%, but actually probably after 2 weeks, you're down to considerably less than X%. Whereas with the Stimulate, what seems to happen is you start off at 1%, and as the filler slowly breaks down over the kind of 9, 12, 18 months that the filler's mostly in situ, it just slowly releases those calcium microspheres over that time. So you don't seem to need as much to get a nice result. Yeah, I mean, it's not going to be as good as a pure calcium product. Of course it's not. But it means you're using less filler and a little bit of calcium and getting, a nice result in terms of volume and a nice result in terms of kind of skin improvement over the next few months.
One of the challenges with fillers is treating hyperdynamic areas. So, like accordion lines and, places where you don't actually have a structure to lay them on.
Yeah.
How does Neauvia kind of respond in those sort of hyperdynamic areas?
Flux, the kind of weird product that we don't quite. So yeah, it's really good for kind of accordion lines. You can just put a sheet of it in there, and because it's got that extra flexibility because of the length of the PEG molecules, it does seem to kind of respond quite.
So you
nicely.
don't get that weird kind of look.
Where it kind of all moves slightly out of sync with the rest of your face. No, and even and the weird thing is, even Stimulate, like when I'm teaching and training with Stimulate, I do lots of it into kind of that preauricular area and go subcutaneously. And you would think with the product as thick as Stimulate, as I say, it's the same HA as their kind of thick product. You would think you'd kind of put it in as a sheet and you'd be able to feel it. And I always get my trainees to do it to prove a point. You put it in and then you kind of have a feel and you're like, where's that gone? It seems to integrate into the tissue instantaneously. I don't quite know what it is about these fillers, but they do seem to integrate beautifully, which is one of the things I kind of liked about them.
Interesting. What do you think about the word integration? A lot of people, I know exactly what you mean. It feels like it's sort of mixed in and it becomes part of you, but do you actually believe that fillers integrate?
No, I don't think they truly do integrate, but it seems to kind of spread beautifully within the tissue so that you can't palpate it. I think it's probably a more technically correct kind of way of describing it. But certainly kind of after you put it in, you have a good feel and you're like, yeah, that all feels really nice. No palpable product.
We were having a chat over dinner last night about biostimulators, and we were sort of trying to classify that, would you choose this one for, your face, or would you choose this one for someone else's face? And I think there are so many coming onto the market now, and especially with people making their own home brew as well, that it's very difficult to know what product to choose for what, and what do we even mean by biostimulation? So what type of patient are you using your Stimulate for, and why?
I'm using it for kind of the standard patients with volume loss, so that kind of preauricular volume loss. It's great at replacing that volume, but I kind of figure it's going to improve the overlying skin as well, which, when you've got those accordion lines, it's going to be helpful. The other place I tend to use a lot of it is kind of marionette area, again, because that skin down there can get a little bit kind of worn, and it's an area with a lot of movement. So you can get a nice kind of volumizing effect with then that kind of added bonus of improving the skin quality over the next little while. So I don't necessarily can personally think of it as, this is a biostimulator. It's like, this is a filler that just has like extra properties that my other fillers don't have. So I kind of sell it to my patients that they're getting 2 treatments for the price.
So that volume or that HA in the Stimulate, how does that equate to like a named filler that we might be able to equate it to? What volumization can you get?
You can probably get about the same sort of volumization as something like Voluma. So somewhere probably slightly between kind of Olift and Voluma. So decent volume, but then with that added bonus a few months down the line.
We were talking about David's beautiful face, getting a little bit of a refresh for him. Do you reckon it'd be a good candidate?
Yeah, it'd be good.
You got some boxes with you?
Yeah, but I'm not allowed to inject them. So I'll find someone. We'll find someone.
We'll see if we can reach out to Neauvia and see what we can do.
Yeah, we'll crap some content out of it.
Yeah,
it'd
exactly.
be great. So is there any other adjustments that injectors need to make when they're administering this product? So we mentioned, more effort with extrusion. But is there anything else in terms of, where they place it, layering, volume, depth? I mean, you said, you get 20-30% more lift. Does that mean you need 20 to 30% less product to get the job done?
And that's the other nice thing we found about it. What used to be a kind of 4 syringe treatment is now a 3 syringe treatment, which is great. From a business point of view, that's great. You can either, you've got a couple of ways of playing that. You can charge the same, but you're using less product because the patient's getting the same result, or you can still charge for a 4 ml package if you want. You can add in an extra syringe and get them an even better result. So it depends which way you want to kind of play that. So that's kind of quite nice. The thing that does occasionally pop up in people that have tried it but without necessarily having been in any training is pop-offs. So kind of popping the needle or the cannula off the end of the syringe. Because of the high extrusion force, you do have to make sure that the syringe and the cannula are screwed on as tight as humanly possible. Which, it's like all of these things. Like you say, you just have to make little adjustments. Which I don't even notice I'm doing it now, but I just kind of screw the needle or the cannula on until the little spines on the inside of the cap snap off, and then I know it's screwed on tight enough and it's not going to pop off. So I've not had a pop off for about 3.5 years of using it now. But I think when people first start, if you just gingerly put the cannula on like you normally would, you are definitely going to be squidging an entire mil of filler onto the side of someone's face.
You mentioned one of them comes with the cannula and size of needles. So what comes in a box typically, and how many mils or whatever in each syringe? Yeah,
so the syringes are a standard mil. In the kind of thicker end of the products, so kind of LV, Intense and Stimulate, you get a 22 gauge TSK cannula. At the thinner end of the spectrum, where you've got the kind of lips and rheology and the kind of slightly weird flux, they come with a combination of either a 27 or 30 gauge needle or one of each, depending.
So that's not a problem. 30 gauge needle, it goes through quite nicely.
The thinner ones will go through a 30 gauge needle. The thicker ones definitely will not.
Cool. Now, you mentioned dissolving, but like any sort of extra information? Do you use ultrasound when you're sort of doing your typical dissolving? Like, does the PEG technology need anything extra, I guess is my question.
No. We've had ultrasound in our clinic for ages now, I can't even remember. And I think I first dissolved an issue in 2019. Under ultrasound guidance back in the dim and distant past. I think I was the first person in the UK to dissolve under ultrasound guidance. I wouldn't bet money on it.
Write it up.
I wouldn't. Well, I offered. I said this was a patient that came into A&E when I worked there, and we were kind of sitting there waiting for the hyaluronidase to come down.
You did it in ED?
Yeah. They were sitting there waiting for the hyaluronidase to come down from ophthalmology theatres. And there are a lot of ultrasound experts in the department that I worked in. So I was sat twiddling my thumbs thinking, what can I do for this patient while I'm just waiting for the porter to run up to theatres and back. And I could ultrasound it and see if there's any blood flow in the superior labral artery. It was just a thought that occurred to me. Let's say this was like 6 years ago now. So ultrasounded it, and there was actually really good flow in most of the superior labral artery, apart from a little bit kind of very central. So I kind of thought, right, that's where I want to stick my hyalase. So I didn't do it formally under ultrasound guidance because that thought didn't occur to me for reasons I don't know. But I at least knew where I was aiming my hyalase. So I kind of stuck a vial of hyalase in, the problem all went away. I did actually write to one of the trade mags in the UK, who shall remain nameless, and say, I've just had this really interesting case where I've kind of ultrasounded it, found the problem and dissolved it. Do you think you'd like me to write that up? And they I think they replied saying, we don't know how interesting that would be for our readers.
What?
I know. I was searching through my emails for an email to the same journal the other day and found that original email and kind of had a little chuckle to myself.
It's because ultrasound wasn't cool and trendy till 2020.
Yeah.
So
there you go.
They didn't even understand.
But as far as kind of ultrasounding Neauvia filler goes, it looks just like other HA-based filler. I do most of my complication management under ultrasound guidance now because it's just a million times easier. Yeah. And I have ultrasounded my patients just to see what the filler looks like. I've not, touch wood, had any that I've needed to dissolve yet. Yeah. But it certainly looks the same under ultrasound.
Okay. Which device do you have in your clinic?
We've got a Clarius at the moment.
Okay. Nice.
Very nice. So how long have you been injecting the product for?
About 3.5, 4 years.
Right. And so longevity, this is, again, a topic that's been widely spoken about, how long these fillers last. Are you seeing any notable difference between, how often you need to retreat, how long these results are lasting?
It seems to last a little bit longer. I wouldn't use it as a selling point that it's like this fantastic filler that lasts for all of eternity. But given it's kind of, it's hidden from your immune system, it does seem to have the slight resistance to hyaluronidase. It does seem to have a greater degree of protection from kind of mechanical breakdown. So we are seeing that it seems to last a bit longer.
Right.
I wouldn't kind of say, that's a selling point for it, but it's a bonus.
And then given it's got this extra lift capacity, do you need to inject less? Do you have more product for the whole face, potentially?
Yeah. So whereas I might have done previously done a bolus of 0.3. I'm now doing a bolus of 0.2, which gives me a spare 0.1 that I can use somewhere else. So you can kind of find you've done the treatment that you would normally do, and then you kind of stood there with 0.2 left in your syringe, and you kind of think, oh, where could I put that? So you can kind of do extra little bits.
It's often the most dangerous bit.
I know. Where shall I put this?
You get clever.
Straight into an artery is where I'll put that.
Okay. I mean, it seems, more efficient. So potentially more treatment indications per syringe, which is good.
Yeah.
I mean, my thought on it was, and I've kind of done a post about this as well. When we first started doing this, and you'll have thought the same, Jake, when we first started doing this, most of our patients were in their kind of 40s and 50s, and we had very limited treatments we could do. We could stick a little bit of filler in the nasolabial fold, we could maybe do a little bit of lips, and that was kind of about all we did. And if there was a line, you maybe put a little line of filler under it. So our patients had a kind of lifetime exposure of 10 to 20 years of very small volumes of filler. And we're now seeing patients in their 20s, and we're doing lips and cheeks and noses and chins and jawlines and nasolabial folds and brow lifts and all sorts of stuff. So, and they're with us for 40 years. So the patient's lifetime exposure to filler now that we know hangs around for a good 5 or 10 years in small quantities is absolutely enormous compared to where we were 10 years ago. So that was one of my reasons for moving, was kind of thinking anything I can do to reduce their lifetime exposure to filler by using smaller amounts and maybe something that's a bit safer just seemed like a good thing to do.
Yeah. Now, we've obviously seen this global trend in the last 18 months of everyone using less filler.
Yeah.
All brands, there's no one reason. It's just becoming less trendy with more options. So we're talking about a new filler brand launching here in Australia, yet lots of people using less of it. What's your view on sort of the market at the moment?
Yeah, I mean, people are moving over to kind of more biostimulatory treatments, bioregenerative treatments, and, they are going to be using less filler, but the advantage is we can still get a really nice result using slightly less filler. So if someone goes, I only want a couple of syringes, then I know I can get probably the same result you used to be able to get with 3 syringes. So I've not been too worried about it in my clinic. Yeah. And then obviously there's all the other things that Neauvia do with their devices, and they do have a skin treatment injectable as well. So, and again, they've done studies that show they all work together to increase bioregeneration and biostimulation. So from a product portfolio point of view, yes, we might be doing a bit less in the filler space, but we've got a skin booster that we can use. We've got devices that we can use. So from a Neauvia point of view, it's fine. From my clinic, I think from a clinic owner point of view, and you can agree or disagree depending on your thoughts, yes, we're doing slightly less filler, but we're doing a damn sight more skin boosters and polynucleotides and energy-based devices and skincare. So revenues are much the same, if not better. It's just a slight shift in balance, which I think has got some of the filler companies a bit perturbed, but
it is what it is. So how are you using this in combination with energy-based devices based on the fact that it is resistant to heat? I know you're a bigger proponent of polynucleotides. So how are you using these in combination therapies? Yeah,
so the nice thing about, and the reason Neauvia wanted to do it is that they have kind of control of the whole portfolio, which, we've known this for ages as injectors. We know that if you do a bit of fillers, a bit of toxin, a bit of energy-based device, you get a much more harmonious, kind of better result than if you just hose a ton of filler into people. The problem is, how do you decide what combination to use and what combination of filler works with what device and what skin booster and this, that, and the other? So the nice thing about Neauvia controlling the whole ecosystem is that they can go, right, we can use our fillers, then we can use our device, and then we can do a study to see which combination works well. Yeah. So we can kind of look at the evidence that's out there, which is kind of quite nice as to which one works better, because they're thermostable as well. A lot of the Neauvia kind of protocols include doing the energy-based devices at the same sitting. So you kind of come in, have your fillers, then go next door and see the skin therapist and get your infrared skin tightening. And because we know the filler is not going to have an issue with that, it reduces the number of appointments that your patients need, which is good for them, reduces their downtime because they're in once instead of 2 or 3 times, and reduces the kind of load on your clinic because they're in and out in one go. So it seems to be a good way of doing things.
So obviously every patient's different, but how do you approach your patients in a consult when you're looking at skin, volume, wrinkles, sag, all the rest of it? Like what's your typical way of approaching? Do you do tox first, filler first, polynucleotides, biostim? How do you do it?
It depends a little bit on the patient. It comes down to the consultation. What's their concern? What is it that they're bothered about? And I will try and address that first, and then look at the kind of holistic, what else can we be doing to kind of get you looking great and feeling better and all the other stuff. But I always kind of try, I think if you can start to kind of tailor your treatment towards their prime concern first, that kind of gets them on side and they kind of appreciate that you know what you're doing. I always like doing filler first, personally, because say my background's emergency medicine. I like to get from point A to point B as quickly as possible, and filler is going to give me that immediate satisfaction my goldfish-like attention span. So I love doing filler first. There is an argument for doing skin first, but that tends to be a much longer drawn-out process and doesn't quite appeal to my ADHD brain. So I love a bit of filler first, but I know I can do the filler. I know I can then toast them with some energy-based device. I can do their skin booster at the same time. So again, it's kind of quite nice for me because I can just dive in and just do everything all in one go if the patient's down for it.
Yeah. Now, off piece, because you are the PN expert, the self-appointed polynucleotide man. So
wasn't me.
No, I'm joking. No, you're a very good speaker about it. So when do you use that, and when is it not an option to use a biostimulator? Like, what areas do PNs work best?
I think the thing with polynucleotides is we know we're going to increase the number and viability of your fibroblasts. So I always think that's a good place to start. If you're wanting some skin treatments, then starting by improving your skin's ability to heal and repair seems like a sensible place to start. All the biostimulators that we use work by stimulating the fibroblasts that are there. So if there's more of them there, there's more that they can do. And all the energy-based devices work by causing some sort of controlled injury to your skin and then waiting for the fibroblast to fix it. So in an ideal world, polynucleotides first. That's going to increase your number of fibroblasts and your viability of your fibroblasts and their ability to function. Then when we wallop them with some calcium or some laser or some IR or some whatever else we want to hit them with, there's more of them to do their job. So that seems like the logical order to me.
Yeah. Cool.
Yeah. And what's the feedback from patients? Do they notice any difference between, this range of fillers, for example, and anything else they've had, downtime, I guess, less inflammation, but like what is the patient feedback?
You seem to get less swelling. It's not a hydrophilic filler, so what you see is what you get. So the patients kind of go out looking how they're going to look. There's not this kind of, let's see how the treatments develop over the next couple of weeks because they kind of attract in water. So the patients quite like that, what they see at the end of the treatment is what they get. The point I would make about the fillers is, or one of the points is that they don't have any local anaesthetic, which again, some people have a bit of an issue with. The odd patient finds it a bit more uncomfortable, but they're super happy with the results. So they tend to kind of grin and bear it, and they're not coming quite as often. So it doesn't seem to be an issue. And again, if you take things nice and slowly, you can make the treatments comfortable. So I don't find the lack of local particularly an issue. I've always thought local infillers is a bit of a weird thing anyway. We know it takes 3 to 5 minutes to kick in, by which time I've finished doing the treatment anyway. So, by the time the local's kicking in, I've taken the needle out of the patient and I'm on to the next area. So I've never particularly thought it was important. Lips, maybe, but I do a block for all my lips, so it doesn't bother me.
Right. So no one's listening to this podcast. So you've never mixed local with your filler?
It has been tried. It doesn't seem to make any difference, is the honest answer. And if you speak to the science bods at Neauvia, and this is borne out by a couple of studies from forever ago, if you mix local with filler, it changes the rheological properties.
Definitely will. Yeah.
So Neuvia's argument is we've designed this filler to have these specific rheological properties that mean it does what we want it to do. If we then go fannying about putting local in it, we'll change that and we'll have to restart again from scratch.
Yeah.
So I didn't know that. I didn't know that it didn't make a difference having the local in it. So why would companies go to all that trouble to get something registered with a local in it, and then it also makes it a scheduled medication? That's what actually makes it a scheduled medication here in Australia, isn't it?
So
no, because Neauvia is scheduled and doesn't have local.
Is it? Okay.
Look, so
it's complicated.
I can't speak for the TGA or how it was registered, but generally speaking, anything injectable, barring a few exceptions, is just deemed a medicine here, which kind of is your problem in the UK where you don't have that. Yeah, exactly.
I would love that so much.
Yeah, there's a few exceptions like with Duran.
Right.
If these fillers are, I think you said slightly stiffer, more punchy in terms of their lift, do they feel firmer? Do they feel lumpier for a period of time?
They can for the first kind of 24, 48 hours, but I say they do seem to integrate, or whatever you want to call it, kind of really nicely, very quickly. So yes, the first 24, 48 hours, it can feel a bit kind of stiff and a bit kind of palpable, but it settles in really kind of quickly and really nicely.
Maybe something to tell patients who are new to it, because they'll freak out and go, oh my God, this is different.
Particularly in the lips, which is already a massive hand-holding exercise for most injectors anyway. Yeah. In terms of the commercials, what does it look like from a clinic owner's perspective in terms of, profitability? And
how much money do you make?
Yeah.
It's cheaper than some of its rivals. So, it's a nice filler to use from a clinical point of view. And it's not as expensive as some of the other products that are out there. to be honest, that doesn't bother me at all. I'd rather have the product that works well for my patients, and if it costs me a bit more, it costs me a bit more. I just put the prices up. It's a nice company to work for. They chuck lots of freebies at you in terms of squeezy balls and stuff you can give out to your patients, and ice packs and towels and all that sort of stuff. So, and it's all very nicely branded. For anyone who's not seen the branding, they have this very strong kind of red branding. Red is their colour, hence the t-shirt.
Yeah, right.
I got paid extra for wearing this. No, I didn't really.
This is non-sponsored, Steve.
So no, they've got a kind of nice branding, and they do kind of produce some nice marketing materials, which makes it kind of easy for your clinic to kind of to talk about what you're doing in countries where you're allowed to talk about what you're doing.
Yes.
So yeah, it's from a kind of from that point of view that you get some good support and some good kind of clinic materials to use. Price wise, I don't think about that huge amount, but it is cheaper than some of the.
I mean, it is an issue for some clinic owners, particularly, in the hyper competitive space. They are looking at their margins. If they can get a great product that's going to make their business more profitable, then that's something that I'm talking to my clients about. But your mileage may vary depending on your how busy you are and where you are in your career.
Yeah, I mean, obviously you're a KOL, so maybe your experience is different. But how would you say that the company supports Injectors? What kind of education do? They have an online platform?
They do, yeah. So obviously I can kind of talk about what we do in the UK because that's where I live. So in the UK, there's about 9 or 10 KOLs, and we put on kind of at least, I do training for them kind of once a quarter, but so does everyone else. So there's at least 2 or 3 training sessions every month dotted around the UK. And we have different, we'll have one that's about the skin boost of the Hydro Deluxe. We'll have one that's about lips, one that's about mid-face, one that's about approaching the whole face. So you can kind of dot about and do different training with that. There is something called the Neauvia channel, which is their kind of online platform. It's got hundreds and hundreds of videos on it, some about the devices, some about skin boosters, some about fillers, some about business, some about everything. Because we have KOLs all around the world, it's in lots of different languages, but you can filter it by English for people like me who only speak English. And to be honest, the majority of them are in English because we know that seems to be the language that most people speak. So they've got lots of kind of online stuff as well. There is, I don't know if I'm allowed to give you a sneak preview of it. There is an app planned for launch at some point next year, which will have access to purchasing things, and it will have all the videos on one platform. The plan is to have case studies built in there, so you can kind of go, right, I want to treat someone's skin. What interesting case studies, what protocols have people used to treat skin? So you can kind of filter it by skin, or you can filter it by products that you own. So it's like, what treatments protocols have people used with their Zafiro IR device, and you can filter out case studies based on that. So that's going to be very exciting, but that's a big project to launch.
Cool.
Next year.
I don't suppose you're allowed to say, or even if you know, any new innovations coming, any new fillers, any toxins coming to the portfolio, anything like that you can share?
At the moment, as I say, we've got the kind of 6 different fillers. We've got the skin booster, so I think they're kind of happy with where they are with those at the moment. Device-wise, we've got infrared skin tightening, we've got laser skin resurfacing, we've got a plasma pen, we've got hair removal laser. I think that's about it. I forget. There's enough stuff. So I think at the moment, product-wise, they're kind of okay. They may have some kind of special products and secret kind of skunk work somewhere where they're working on something, but nothing that anyone's kind of revealed to me, probably because they know I've got a big gob and I'll just tell everyone about it. So they'll probably keep secrets from me. Yeah. I think the big project at the moment is going to be this kind of online app and kind of portfolio where we can kind of really help support new injectors and even experienced injectors. So I think that's the kind of next big project. So in terms of a toxin, and I think we discussed this a little bit last night, I think once you bring a toxin into your portfolio, you become a pharmaceutical company. And once you become a pharmaceutical company, you open yourself to all sorts of rules and regulations about what you can talk about and what you most definitely cannot talk about and how you can act and things like that. So I suspect from a Neauvia point of view, that's probably not something they're going to be super keen on.
Yeah, interesting. I mean, I'm not sure whether there's so many toxins now that whether that would be difficult to launch anyway. Who knows?
Yeah.
What's your favourite toxin, just out of interest?
So I am also a KOL for Neauvia, so I am contractually obliged to say that Neauvia is the best toxin on the face of the planet. So I've been using Neauvia since it was launched in the UK, and I mean, as kind of David alluded to earlier, they all have their own little nuances. Yeah. And again, I can always see the Neauvia guys standing at the back of the room with their head in their hands when they see me get up on stage. All toxins work. They're all good. They all do exactly what they say on the tin. If you stick them into patients' muscles, their muscles will stop working. But they all have their own little nuances, and it's about finding the one that works for you. And for me, Neauvia works the way I want a toxin to work in my patients.
Yeah.
Does that make it any better than any of the others? No, not really. Does it make it worse than any of the others? Definitely not. It's just the one that works for me. So, you know, I always say when people come to my training, go home, give it a try. If it works for you and your patients, great. If it doesn't, you know, they'll still pay me for teaching you.
So you're obviously here in Australia, first time here. How are you enjoying it?
Good so far. I mean, to be honest, I arrived like Monday night at 11 o'clock and it's been a bit of a kind of whirlwind since then. So I've kind of seen bits of it. We had a little a little drive out to see your big version of the Tyne Bridge, which was quite nice. And we kind of drove down to see the Opera House. So I've seen a couple of bits and bobs. And I've actually got a day off tomorrow. So I'm going to do the little chat GPT of I have one day in Sydney and I am starting from this point and I want to walk around and see all the things I need to see.
There's a couple
which I found works quite well, actually.
Yeah, I definitely would recommend doing like a coastal walk, like a Bondi to Bronte is kind of nice walk. That right along the coast. It's good weather at the moment. There's lots of whales.
It's melting at the moment.
It is. It's very hot today.
Although my internal thermometer is completely goose. So I've come from the UK, which is currently about 9 degrees. And I was in Dubai for 2 days where it was 38 degrees. Then back to the UK for 1 day. Then Bali where it's 36 degrees and it's essentially like being in a steam room. And then here where it's 30 odd degrees today.
Drier.
So my internal thermometer has just given up the ghost.
So definitely do a coastal walk. Opera House, walk through the CBD. Bondi Beach is a must.
As long as I cross at crossings.
Yeah, and it'll be nice as well to maybe catch
the noise as you go.
Apparently I'm not allowed to act like a grown adult and just cross the road when it's okay to cross.
No jaywalking.
That's not allowed.
No.
Okay.
And maybe you catch the ferry across to Manly. Could be nice.
Yeah, someone else has suggested that.
That's nice. There's a nice bar on the other side you could get to.
That sounds good.
Yeah.
But you're here tonight to do a big sort of Neauvia event, and obviously the podcast will be out after that. But what are you guys speaking about? What's the purpose of the event?
Yeah, so the purpose of the event tonight is to kind of launch Neuvia's focus for the next year, which is kind of their focus on bio-regeneration, which I know is a kind of buzzword within the industry at the moment. So it's talking about a little bit about kind of introducing the products, because there's going to be lots of people there that have no idea what they are and who they are and what they're about. So a little bit about, similar to what we've done today, talking about kind of what they are and what they have in their portfolio, but then actually looking at their focus on bio-regeneration, which is basically looking at how you can use all the different products in their portfolio to kind of generate bio-regeneration within every layer of the skin. Because obviously we've got these skin boosters that we can use superficially, we've got fillers that we can use deeper, we've got devices, we've got a laser skin resurfacing laser which can use superficially, we've got IR that works down to kind of 4 millimeters. So we've got this whole kind of gamut of kind of products that we can use and combine to kind of increase bioregeneration at the dermo-epidermal junction within the dermis and kind of deeper down to the subcutaneous fat. So it's talking about essentially how you can use the whole portfolio to get some really nice kind of holistic results for your patients that don't just involve them looking like an overinflated beach ball with 20 mils of filler in their head.
Yeah. So obviously you're speaking. Anyone else speaking?
Yeah. So we've got Rebecca Altamonte from Faces by Rebecca, who is one of the early adopters of Neauvia in Australia. She's got one of the Zafiro infrared devices. So she's talking a little bit about how she's kind of integrated that into her business and how she kind of had a launch strategy to kind of generate lots of income from that from the outset. So I'm talking a little bit about the products and kind of the science behind it, and she's talking a little bit about the kind of business case of how you can, launch this portfolio of products into your clinic.
So what's an infrared device? Is that laser or is it not a laser?
No, it's infrared.
Right. No, that's that's a stupid question, but I'm trying to labour the point. That's
like
different.
LED, is that what you mean?
Yeah. So it's infrared skin tightening. So it's basically a kind of piezo crystal that fires infrared kind of deep into the skin. So down to about 4 millimeters. So the advantage with infrared is you get uniform heating across that whole kind of 4 millimeters. So you get uniform heating from the kind of dermo-epidermal junction down to the kind of deep dermis. And it heats to just under 60 degrees, which kind of solubilizes your collagen. So kind of makes all the collagen there shrink, but then also stimulates your fibroblasts to produce some more collagen. And obviously, because it's Neauvia, they've got some studies that show that it increases your number of fibroblasts as well. So you've got an increase in the number of fibroblasts, you've got an increase in collagen production, which gives you a decrease in wrinkle depth and an increase in kind of skin quality. So, and we know that the infrared and the laser that we have, the Laser Me device, which you guys don't have yet, but we have in the UK, they have water as their chromophore. That's their kind of target substrate. So if we've done some Hydro Deluxe the week before, which is our skin booster, which is an uncross-linked HA that increases the hydration of your skin. So we do that a week before, get lots of extra water into your skin, and then frazzle it with some IR or some laser, we get a better result because we've got more target. So that's the kind of theory behind this whole combination project that we can think about, right? If we're going to use a skin device, what do we need to do to prep the skin before that? And have we got a product that does that? So skincare and the skin boosters prep the skin, the devices then use that extra water as their target, then we volumize them. We've increased the number of fibroblasts with our IR, and then we put some stimulate in that's got some calcium in that stimulates those now extra number of fibroblasts. So the idea is that it all kind of works together.
Nice.
Excellent.
Well, it's been an absolute pleasure to have you in our studio. Finally, a real person here.
Yeah.
Nice to see you in person. Thank you so much for not just being a great guest, but being a great member of our Patreon community and all the banter and stick that you give me in our chat groups.
Yeah. I mean, we'll not mention the banter from last night because it's definitely not for broadcast.
No, definitely not. But anyway, look forward to seeing you speaking tonight. And thanks again for being a guest.
Absolutely my pleasure.
Cheers, mate.
No problem.
We hope you enjoyed that episode, guys. To stay up to date with our latest news and episodes, follow us on Instagram, and we're now on TikTok.
You can also now watch our full video episodes on YouTube and Spotify. So if you like what we do, please give us a like and subscribe. Please also consider joining our Patreon for invaluable business and injectable education. Get access to our global community of like-minded professionals, hints and tips videos, bonus podcast content, and more.
All of our social links, Patreon, and contact information are in the show notes below, and we'll see you in the next episode.